More than 300 million people worldwide are living with asthma, and a quarter of those right here in the U.S.
Yeah, and a new report out by the Center for Disease Control states that these rates are at an all-time high. Dr. Poonam Alaigh is our medical expert here now to discuss this growing problem. Good to have you back.
Yeah, nice to be here.
So we had talked about asthma rising amongst children. Is this now a problem amongst all age groups?
Yeah, I think you actually bring out a really good point. We all know asthma is a childhood disease, but last month there was a study that was just released about the baby boomer population, how the elderly population also get underdiagnosed with the condition. And as a result of it, it becomes a serious disease because the mortality rate for the elderly once they get hospitalized is 14 times higher than the rest of the population.
Is this something that they've always had, or is this something that is triggered by an external component?
A lot of the elderly do have had symptoms of asthma growing up as a child, and when they become older and they talk to their physicians, it's always, in many cases, sort of dismissed as part of aging, or maybe as a result of the underlying heart disease, or the fact that they're just deconditioned. And so it's important to be able to recognize it, because again, in studies, we've seen that this population is not only underdiagnosed but undertreated. And if undertreated, then mortality rates obviously go much higher.
And I'm guessing, but you probably know this, is this part of the, as we age, immune system kind of goes down a little bit, and as we get older, you know, populations living, you know, well into their 70s and 80s now, we're seeing more of this.
We're seeing more of this, and again, it truly does have a genetic link. So you do have a genetic predisposition to it. Now, certain susceptible individuals do get asthma and certain don't, and a lot of that is as a result of environmental factors. So the common allergens that hit you when you have allergic, allergies and seasonal, changes, those things are the same triggers. In addition, secondhand smoke is an important trigger. Having infections like a URI, upper respiratory tract infection, the flu, pneumonia, all of these things trigger your asthmatic attack too. So it's important that this population understand and know their symptoms, know their triggers, and at the same time work with physicians to develop an action plan, an asthma action plan, so that they do understand what the risk factors are, where they are in the spectrum of disease. So you could have a mild disease, you can have moderate disease or severe disease, and based on that you can go into the spectrum back and forth. So it's important to...
You mentioned the triggers. What are the symptoms, which I'm sure can be easily confused with a common cold?
Yeah, absolutely. So typically what happens in asthma, it's a chronic condition of the respiratory tract. And patients, when they have asthma, and it is a chronic condition, you have chest tightness, you have coughing, you have shortness of breath, and you have wheezing. And you can have all or some of these symptoms. So it's important to know what your symptoms are, and really talk to the physician about how you're going to manage the disease. An interesting study that came out actually recently talked about physicians saying that they had talked to their the patients about the asthma, came up with an asthma action plan in 70% of situations. But when those patients were asked if they had an asthma action plan, only 27% said that they did. So there is that communication gap that we truly have to improve.
So you have to follow the doctor's instructions, is what you're saying.
Not only follow, but if you don't understand the instructions, then you have to be an active and engaging partner in managing your own disease.
You mentioned something earlier about the connection with smoking.
Yes.
Is that something new, or have we known this for a while?
We've known this, but again, the secondhand smoking is something that we don't elevate to that level. Obviously, direct smoking effects, we all know all the problems with that. But more and more literature now is on secondhand smoke, and that actually has shown to be a strong trigger.
Can you cure asthma?
Asthma is a disease that can be managed really well. It can be controlled very well. There is no cure for asthma. There is a certain population of children that outgrow asthma. However, a lot of these children, about 50% of the children, will have symptoms of asthma when they're older, when they hit their adult years or older adult life.
Does asthma actually trigger anything else, or is it just does it exist on its own, or is it one of those ailments that can trigger other things?
Well, asthma is a lot of times associated with other allergies. So you have seasonal allergies, some dermatitis type diseases. So yes, it's sort of a spectrum. You don't have to have all these different entities hit you, but yeah, there is a concomitant increase in certain conditions as a result of asthma. The more important thing is that if asthma is not treated, it results in restrictive lung disease. You know, it results in scarring. It affects not only your quality of life but lung function at the same time. So it's important to manage asthma, control asthma, and if you do, there is nothing that stops you. You can be what you're meant to be and live an optimal life.
And of course, we want to mention this is Asthma Awareness Month. Good time for folks to take stock of those trigger things you talked about.
Yes, absolutely.
Thank you so much for your insight and analysis as always, and look forward to having you back again.
Yes, thank you.